Good evening, everyone. This is Meldita, and I'm back here at my YouTube channel, Meldita's Info Corner. My Facebook is joanrigacho@yahoo.ca. Okay, reperfusion or reperfusion injury after stent insertion in patients with STEMI. Last time we spoke about reperfusion, and this is about a successful stent insertion. Okay, but this time we will be talking about reperfusion injury. So let's take a look at the difference and the similarities. Okay, when you speak of reperfusion, we have here a successful stent insertion. So we have a drawing here. So we have here a proximal RCA occluded. Okay, so this is an RCA occluded. So we place here a stent. So we inserted a stent in here. That is the job of our interventionalist. Okay, and the circulation starts flowing from here down to the distal branches, the smaller arteries, going to the affected heart muscle, and we are able to restore the function of that heart muscle. Okay, so here we go. So we have a black coronary artery. Okay, we inserted a stent. The artery is open. We revive an epicardial blood flow going to the distal area. So we have a distal blood flow. These are the smaller arteries. And we have a blood flow going now to our affected acute ischemic cardiac tissue, and we're able to restore its function. So the TIMI flow here is 3. So we have a normal circulation restored, and we have here a successful reperfusion. So the chest pain is gone. The S elevation continues to come down. We have reperfusion arrhythmias. Commonly, we have AIVR or slow VTAC and PVCs. And these are related to automaticity, and they're benign. And the others, few of them happens, but they are not related to reperfusion injury. So reperfusion, okay? And then the STEMI evolution is shorter, and the recovery of the organ affected is faster, including its function. Okay, so reperfusion, PCI is successful because we restored an epicardial blood flow and a distal blood flow, and flow to our acute ischemic cardiac tissue and restore its function. What happened with reperfusion injury? Well, this is the reverse, reperfusion injury. Well, there are not all cases of STEMIs will end up with reperfusion injury, but there are factors that can provoke a patient to go into reperfusion injury. We have late STEMIs. We have also CHF, ejection fraction, okay? And diabetic people, we have diabetes. Okay, so what happened with reperfusion injury? So with reperfusion injury, we have here a successful stent insertion epicardially, but distally there's no blood flow, and there will be more damage to the heart. Okay, so let's go back to the drawing. So here, this is a right coronary artery blocked. So that is proximally. So a stent is inserted. We are able to create a blood flow in here, but going down, there's no more flow down here. Okay, so maybe these smaller branches will benefit from the blood flow, but there are some issue also, myocyte injury here, further injury. Okay, so what happened here? Let's go back to the drawing. So we have a black coronary artery. We put a stent. We open the artery. There is epicardial blood flow, but there's no blood flow. The TIMI flow is less than 3. So there's a paradoxical effect. What happened is you open the epicardial artery and there's a blood flow, but the opposite, there's no blood flow distally. A TIMI flow of less than 3. So we have here reperfusion injury. So because the reperfusion itself failed. Okay, so what you see here, manifestations, we see a lot of things here for nurses. The chest pain might remain or gone. Okay. The S elevation, very obvious, remains elevated. There are arrhythmias, but these are not reperfusion arrhythmias, BTAC and BFib, because they believe that reperfusion injury, there could be a progressing STEMIs until all the cells, of course, die affected by that black coronary artery and it stops. Okay, so the STEMI evolution is longer, and we have more injury, more dysfunction, and more complication. Okay, so here, as we said earlier, there is a TIMI flow of less than 3 compared to the TIMI flow 3 of reperfusion. The TIMI flow of reperfusion injury is less than 3. Okay? And in here, that's it. we did not revive it. In spite all the management that we did, all the medication that we give, clots remove, atherectomy or anything, we give even intracoronary vasodilator, is still a TIMI flow of less than 3. So as I mentioned about the factors involved already, late STEMIs, diabetes, CHF, ejection fraction. Okay, what happens during reperfusion injury? So let's talk about the vascular problem. So there's no blood flow because there is microvascular obstruction caused by clots, thrombus, embolus, or traveling clots. And then we have also external compression. If there's hypercontracture of the myocardial muscle, vasoconstriction, there's alpha stimulation, okay, or hormones, inflammation, there's myocardial edema and endothelial swelling. So how about this contraction by the myocardium? There is myocyte hypercontracture brought by influx of calcium inside the cell. Myocardial stunning, maybe the myocardial stunning, maybe a little bit more. Probably it might happen, but I said there's a late presentation here. And then we have also autoradicals, free radical effects, and electrophysiologically, we got symptomatic or fatal arrhythmias, okay? And the bottom line here, the worst part of there is more myocardial cell death, okay? So as I said, this one doesn't happen all the time with STEMIs, but there are some cases where we get patients and their TIMI flow is 2 or maybe less than, and we see that there is ST elevation remains, and we'll keep an eye because why? Complication is our problem here. There are many complications in here. So watch out for that. You can possibly end up, many things. You could cardiac arrest. It could be, because you are trying to expand the extension of the STEMIs here, aneurysm. Many things can happen possibly. I don't mean only with reperfusion. It could also happen possibly with successful reperfusion, but just, keep an eye. But the prone or possibilities is more probably with reperfusion injury because of the prolonged presentation and more factors involved. Okay, so that's about it. And as I mentioned, reperfusion, we have here a successful PCI insertion because we establish here an epicardial flow and distal flow and saving the heart muscle involved. While reperfusion, we have here a PCI insertion. Well, we have an epicardial flow, but we don't have a distal flow, and we have more injury and maybe more myocardial cell death, okay? So that's it. And both of these, the coronary care nurses will be vigilant about the rhythm and their assessment and everything. Okay, so with regards to the management, as I mentioned, is the same. Antiplatelet medication before and after, and watching for Piasen episodes or whatever, ECGs, monitoring rhythms and everything. And also the doctors doing all this clot removal, crushing all this atheroma, and then, putting on intracoronary vasodilator, all these maneuvers and everything. They are the same. The only difference between reperfusion and reperfusion injury is that their TIMI flow is different. So the TIMI flow is 3 for reperfusion. The TIMI flow for reperfusion injury is less than 3. Okay, and their difference here, I mentioned already about their pain episodes, their ST elevations, and their arrhythmias and everything. Okay, so the succeeding videos actually will talk about, I will be showing you the video on reperfusion and reperfusion injury, comparing them, so that we will see the difference. Okay, that's about it for now. Thank you.